All right. Welcome everyone to another webinar from the Beef Reproduction Task Force. My name is Vitor Mercadante. I'm an associate professor at Virginia Tech, and I'm currently the chair of the Beef Reproduction Task Force. And we've been doing these webinars on the fourth Wednesday of the month. So we had one last in January, some technical issues back then, but I'm pretty sure we're not going to have that happen today. And we're going to continue this series all the way until June. So, follow us on Facebook. Make sure you join our YouTube channel because these webinars are being recorded and posted there. Follow us on Twitter, and also check out our website to stay up to date to everything that we do at the Beef Reproduction Task Force. So today we have two presenters. We have Dr. Lee Jones, who is an associate professor in the College of Veterinary Medicine at the University of Georgia, and he's also a member of the Beef Reproduction Task Force. And we have Dr. Pedro from the Animal and Dairy Science Department at the University of Georgia. So we have two folks from the UGA joining us for this webinar. I also want to make sure that I thank our sponsors, our diamond level sponsors, because they're the ones that make this webinar series and some other programs that we do at the Beef Reproduction Task Force possible. So I want to thank Astrotech, Reprologics, Beringer Ingelheim Animal Health, Merck Animal Health, Elanco, and the Texas A&M Pregnancy and Developmental Programming from the Animal Science at Texas A&M. Thank you very much. We really appreciate the support. And again, we can make those programs available without the support from our sponsors. So thank you very much. Without any further ado, Pedro, if you want to, I'm going to stop sharing. So if you want to share your screen.
Sure. Let's see here.
All right.
Can you see?
Yeah.
Can you see my slides?
Yeah, we do, Pedro.
Perfect.
All right. Thank you very much.
All right. Thank you, Vitor. Thank you for the introduction. So, welcome everyone. It's always nice to be here again in the Beef Reproduction Task Force webinar. Today, I'm going to start a presentation where basically Dr. Jones and myself and Dr. Jones, we're going to be going over pregnancy loss in beef herds. So for my first 15 or 20 minutes of presentation, I'm going to be covering more of what we would usually define as normal pregnancy loss that occurs in beef herds. And then as we move towards the end, Dr. Jones is going to approach it with a little bit different perspective, more from a herd health standpoint and potential infectious diseases that could be causing pregnancy loss. But for my part of the talk, first, I'm going to try to give you guys an overview of early pregnancy establishment, because I think it's important that we understand some of those biological events, because once we appreciate the complexity of those events, we can have an appreciation on the magnitude of pregnancy loss and why some of those pregnancy loss might be occurring. So I'm going to go over also when those pregnancy losses occur and how they actually influence performance in the cow herds, in commercial beef cow herds. And then hopefully, I try to set this up in a way that you go home with some take-home message of things that you can actually go there and actively incorporate into part of your management in your operations. So in a sense that, I'm going to show you we can do some management strategies to minimize some of those pregnancy failures. And then hopefully at the end, we have some good discussion about it, right? So in several of my talks, I usually bring this slide, which is a slide that I use to characterize and explain how early pregnancy establishment occurs, okay? So this is a diagram or a drawing of the uterine horn of a cow, okay, as well as the oviduct. So we know that in cattle, fertilization occurs about halfway through the oviduct here, okay, a few hours after we have ovulation. And usually, for the most part, those fertilized structures, right? So we're going to have that oocyte being fertilized. We're going to form an embryo. So that embryo is going to arrive in the uterus usually around day 5.5 to day 6 of the estrous cycle. Okay, so if you have been involved in embryo transfer programs, you know, if you might have some donors at your place that you flushed before, and the embryologist, you know, call you and told you to look in the microscope, you probably saw something like this. These are 7-day-old blastocyst embryos. So this is how they look like when you usually flush a group of donor cows or after incubating in an in vitro production system, okay? But we know that as we progress in pregnancy, those embryos go from a spherical form to an elongated form. So when they are in this spherical form, they are protected by what we call a zona pellucida, which is basically a protein layer that protects that embryo. And usually around day 8, this is an electron microscopy image here, you can see that that embryo is hatching that protective layer, that zona pellucida. And, you know, once that embryo hatches, it's interesting that it's quite different in humans, right? In humans, the embryo is still spherical when it starts attaching to the uterus and trying to establish that pregnancy, right? But in cattle, that embryo kind of hangs around for a few days before actually undergo what we call attachment. So if you go there and flush those embryos, let's say around day 13 after insemination, those embryos have a tubular shape. And that's what I got depicted here. And also an electron microscopy image here. You can see that that embryo starts gradually elongating. And as that embryo elongates and increases in size, it really acquired that filamentous floss. It looks like really a dental floss, you know, that's filamentous shape here that I have here on day 17. Okay. One of the things to keep in mind that most of the structures that you're seeing here, okay, this is predominantly what we call the trophectoderm. So that's what's going to become the placenta of that developing pregnancy. So at that stage, that embryo is basically trying to increase and elongate it as much as it can. So increase its surface area. So it can go there and then around day 20, it start attaching against that uterine lining and start building some communication, some more direct communication with the endometrium. Okay, so you can imagine how much growth it happens, right, as you go in that very short period of time that embryo grows more than 200 times in size. So the biology of it is extremely interesting. But usually when we have those really extreme events in biology, you know, those events are also very prone to error, right? So that kind of explains some of the challenges that we see with pregnancy loss. So this is a figure that was put together by Sydney Reese when she was a graduate student at Texas A&M as part of her PhD program. But basically what Sydney did, she compiled over 50,000 records on artificial insemination, and she went back on the literature and found studies where researchers were actually flushing cows at different stages of pregnancy to try to characterize when some of those pregnancy losses are occurring. Right. And so if you look here in this figure, here on the y-axis, you have the pregnancy rates. Okay. And then on the x-axis, we have the day of gestation. So you notice that as we move forward here, so if you look here on day 0, when we go there and we service those animals, right, 100% of those animals theoretically are pregnant. Right. However, we know that as we progress and we go, let's say here on day 30 of gestation, when we can go there, perform an ultrasound examination and identify the pregnancy, we know that only about 50% of those animals are actually pregnant, okay? So you can see that a lot of pregnancy loss happens within those first 30 days of pregnancy. A good chunk of those pregnancy losses happen within those first 10 days, right? By the time that fertilization occurs until the time that that embryo is actually arriving into the uterus, like I showed you in the previous slide. And then as we move forward in pregnancy and that embryo starts elongating, we still see quite a lot of variation in pregnancy establishment here. But not only that, we see a lot of pregnancy failure as well. So usually when we think about those pregnancy losses that occur in the first 30 days of gestation, we refer to those as early embryonic losses, okay? However, you notice that as we progress in pregnancy from day 30, let's say to around day 65, day 70 here, those cows are still experiencing some losses here as well, right? And this is what we call late embryonic or early fetal pregnancy losses, and that usually represents about 60%, about 6% of the pregnancy losses that we observe. And, those are those pregnancy losses that, you go there, go through the whole hassle of synchronizing your cow, selecting a sire, put those animals in a really good nutritional program. And you actually go there, generate a pregnancy, right? You're happy. Let's say you go there and transfer an embryo, and you have that specific mating that you were able to generate a pregnancy. But then 30 days later, you go there to confirm that pregnancy, and that cow actually lost that pregnancy. And, one could argue that even though those pregnancy losses, on a percentage basis, they represent a smaller number, right, of those losses, a good argument is that those pregnancy losses actually have a greater economic impact, at least on a per head basis. And this is what I'm trying to show here with this table. So here you have a situation where you have, that one cow that become pregnant by AI, and she actually keep that pregnancy. Calf, let's say in the beginning of the breeding season, and she's weaning a healthy, a productive calf, 550-pound calf. If you go there and you plug a dollar value to it, this is, I pull it up from last week, USDA livestock report here in Georgia. So feeder calf prices at a 5 weights, they're going out for about $2 a pound. So in this scenario here, right, that cow will be weaning a calf that would be worth, let's say, $1,100, right? However, if you think about that other counterpart of that cow that actually got exposed, let's say, to that first round of AI, and she undergo early pregnancy loss, we know that those cows that undergo early pregnancy loss, they'll go back and start cycling right away, right? We in the field, we don't pick up those early pregnancy losses. We do not identify those losses because those cows will simply go back into heat. They'll breed back. They'll breed a little bit later. They'll calve a little bit later, and they'll probably wean lighter calves. But still, they're going to produce a calf that we're going to be able to market that calf pretty successfully. The issue comes in those cows that have late embryonic mortality, right? Where they basically, after day 30, they're going to lose their pregnancy. And if they do go back and cycle again, they're usually going to breed around 60 days later. And we know that those late-born calves are substantially lighter. So you start seeing some more significant differences. But the reality is a lot of those cows that experience late embryonic early fetal mortality, they actually never breed back within the same breeding season. So we end up, getting rid of those cows if we have a controlled, tight, well-managed breeding season. So, all right, so I went over some of the basic biology of what's happening, show the magnitude of those pregnancy losses, at least when we look at industry averages, right? But, as producers, what can we do to minimize some of what we call normal pregnancy loss? Let's say we're going into our spring breeding season, folks in Georgia are, ordering semen, ordering synchronization programs, putting together their schedule. So what can they do to, across the country, actually, to minimize pregnancy loss? So in the next few slides, I'm going to go some of the things that we know based on the currently available scientific literature of practices that we can use to at least try to minimize some of those negative impacts, okay? So we know that one of the big impacts, and depending on where you are in the country, this might be something a more common management practice, which is transport cows after a first round of, let's say, synchronization and AI. And there's a few studies out there in the literature that really show a detrimental effect depending on when we're exposing those animals to that transportation stress, right? We know that when we put animals in a trailer, when we haul them around, and we can replicate that experimentally, put animals in a trailer, haul them around, collect a blood sample, and measure markers of stress like acute phase proteins or cortisol. We know that transportation causes stress, right? And what's interesting is that there are studies that show that stress results in decrease in fertility, okay? So, for example, if you look at this experiment 2 here by Tom Gary, you can see that the control animals that were not handled versus the animals that were handled between day 10 and 15 after AI, the control females that were not exposed to a stress event, and again, this is a handling event, running those animals through the chute, okay? We did not see a decrease in pregnancy rates, right? So if you go back to the biology and the complexity of pregnancy establishment around and what's happening around day 10 and 15 of pregnancy when those embryos are elongating, when a stressful event then can lead to detrimental impacts on fertility and pregnancy establishment. But what's interesting is this is a study with transportation stress. So if you go back to what's happening those first 1 to 4 days, right? Those embryos are still in the oviduct. So they're somewhat more resistant to stress events. They're not undergoing those dramatic changes in conceptus elongation and all that. So when you compare females that were transported 1 to 4 days after AI versus the females that were transported 14 days after AI, you can see that the pregnancy rates were decreased in the females that were transported around day 15, right? So if you go back to that slide, that makes a lot of sense, right? Those embryos are undergoing some significant changes at this stage that if we expose them to a stressful event, expose the females to a stressful event, we change that uterine environment to an extent that we decrease the likelihood of generating pregnancies. So if we can minimize those, that's pretty significant. But what's interesting is that it's not only about stress, it's that changing environment also makes have an impact on pregnancy establishment too. Dr. Perry has a series of studies that are really nice from back when he was in South Dakota. So in South Dakota, for some of you there from that part of the world, it's common practice, right, to develop heifers in a dry lot and usually breed those heifers, right as the spring is coming out, and turn those heifers out to graze after that first round of synchronization in AI. And then those series of studies, one of the things that they're noticing is that those heifers that were developed in a dry lot, very often they were experiencing a transient decrease in average daily gain as soon as we turned them out to graze. They did some nice studies where they put pedometers and they show that those heifers, once you turn them out to graze, they actually walk around a lot and they decrease the amount of time that they spend grazing. Okay. And the really small decrease in average daily gain appeared to be leading to some decreases in fertility. So to kind of replicate that, they did a really nice study where basically they had heifers in a controlled diet, where they were receiving a diet to gain about 1.5 pounds a day, or heifers, and then those heifers were all fixed time artificial inseminated and then assigned to one of two treatments. Either half of those heifers were maintaining that controlled diet, whereas the other half of the heifers, again, this is only after AI, right? They were exposed to a somewhat small nutrient restriction. Some of them were exposed to 80% nutrient restriction, and some of them at a 50% nutrient restriction. So again, and that nutrient restriction was for a very short period of time, so only 6 days, just to mimic what happens when you turn those heifers out to a different environment, and they might spend a little bit more time walking around rather than actually going there and grazing. And when they experience those transient small changes or small decreases in average daily gain, right? And what's interesting is they went there in day 6 and they actually flush embryos out of those heifers, and they went there and grade those embryos based on IETS standards for quality and stage of development. So if you look at the control versus the restriction heifers here, you can see that the percentage of embryos that were recovered were similar, were not significantly different. But when you actually look at the stage of development, you can see that the embryos from the control heifers, they were on average more developed. But not only that, they actually receive a better quality grade, right? So those quality grades, if you're not familiar with the IETS system, the lower the quality grade, the better, okay? So you can see that on average, the heifers, they were not exposed to a transient nutrient restriction. Again, for only 6 days, they had better quality embryos as well. They took that a step further and they quantified the number of cells in those embryos, the number of cells that were actually alive. They stained those embryos and they did some pretty neat analysis, and they basically showed that those embryos were basically healthier, right? So whenever we go there and change that environment, and it's a subtle change, right? 6 days, very small period of time of nutrient restriction, we might see some differences in embryo development. So we're changing that reproductive tract to an extent that we're influencing embryonic development and consequently pregnancy establishment. So as producers, if we can minimize those changes and guarantee that those heifers are in a positive plane of nutrition, not only all the way until AI, right, that we know, but actually moving forward after AI during pregnancy establishment, we can actually mitigate some of those pregnancy losses, which ultimately is going to lead to greater pregnancy rates. It's interesting, this is some data from our group, back when we did some transfers in Florida where we had cows that were experimentally restricted. So we had cows receiving maintenance diet versus cows receiving a restriction diet. So there was restricting about 70% of their actual requirements. These are all lactating Angus cows here, okay? And then here you have the percentage of cows that experience pregnancy failure after embryo transfer. And you can see that, the cows that were exposed to the restriction diet, they're significantly less likely to establish pregnancy. And one of the neat things about that study is that we were actually collecting blood samples on day 19 of gestation. So those cows received embryos on day 7 of gestation. So this is blood samples collected 19 days after we went there and gave them a generate shot, or they were in standing heat, okay? And you can see that when you look at the probability of pregnancy and the concentration of two important metabolic hormones here, so insulin and insulin-like growth factor, you can see there is, as we increase the concentration of those hormones around those key periods of development, right? Those hormones like insulin, both insulin and IGF-1, if they're upregulated, they're in greater concentrations in blood, they're basically signaling a more positive energy balance, right? You can see that as those cows increase the circulating concentration of those hormones, the probability of them successfully establishing a pregnancy increases. So not only heifers, like Dr. Perry said, the nutritional status of our mature cows, whenever those key events of pregnancy development are happening, right? That embryo is elongating, is proliferating, is increasing in size, and try to signal its presence to the mother, to the cow. You know, having those cows in a positive energy balance, it's really paramount, really paramount. Another thing to keep in mind, and Dr. Mercadante mentioned earlier, the YouTube page from the Beef Reproduction Task Force, and I encourage you to go back through that page and find Dr. Reinaldo Cook's talk, where he talks a lot about supplementation of polyunsaturated fatty acids to manipulate conceptus development. He has done a lot of work characterizing that. And, you know, here in one slide, I'm going to try to summarize that. But basically what they've been showing with over 15 years of research is that whenever you supplement cows with fatty acid supplement, and there are a series of studies that use calcium salts of soybean oil, which is rich in omega-6 polyunsaturated fatty acids, okay? When you supplement cows with these polyunsaturated fatty acids, this specific set of polyunsaturated fatty acids, you actually, you know, they went there and flush embryos out of the uterus of those cows. They measure, collected biopsies from the uterus, and they measure the amount of omega-6 fatty acids in the reproductive tract of the cow. They're able to show that the uterus actually incorporates a lot of those omega-6 fatty acids and release those omega-6 fatty acids into the uterine lumen. And those fatty acids are actually uptaken by the conceptus. So the conceptus is utilizing those fatty acids to grow and develop. And in fact, in several of their studies, they show that those conceptus are more developed when cows are supplemented with omega-6 fatty acids. And what's interesting is that in their studies, they use isolipidic and isocaloric control. So basically that means that their control cows are actually receiving the same amount of fat and the same amount of energy, okay? So in other words, those benefits come from the actual profile of those fatty acids, right? So that omega-6 fatty acid appears to have some positive effects to the biology of the conceptus that is developing. And as a consequence of that, they actually see increases in pregnancy rates. So this is pregnancy rates of a study that was done by Alice Brandão, which is one of Dr. Cook's graduate student, where basically she showed that when they supplemented cows with those omega-6 fatty acids, they observe about a 10% increase in pregnancy rates to the first round of fixed MDI. In a subsequent study, they went there and actually validated the use of tubs. So we can expose cows to those specific supplementation strategies with some pretty minimal labor when you utilize those tub type of deliveries, delivering those omega-6 fatty acids and lick tubs. And again, the key period, the key point here is that those studies, they supplement cows during the first 20 days of gestation, between 20 and 30 days of gestation. So it's a really specific targeted supplementation strategy that has been shown to favor conceptus development and repeatedly increase pregnancy rates to fixed MDI. So again, some practical applications there. Another point that I want to make here is estrus expression, right? We can go there and collect things like estrus patch scores or actually observe those cows in standing estrus And this is the data that is also very repeatable, both for fixed time AI as well as fixed time embryo transfer. When cows express estrus, they not only have greater pregnancy rates when we do a pregnancy test around day 30 of gestation, but those differences are maintained when we confirm that pregnancy later on. And when we actually go there and look at the cows that lost pregnancy between the first and the second AI, we see a decrease in pregnancy loss when cows express estrus. Okay, so estrus expression is not only favoring pregnancy establishment, let's say all the way until day 30 of gestation, but also increasing the likelihood of those cows actually keeping those pregnancies as gestation progresses. So the biology of the cows that are expressing estrus, the biology of the reproductive tract is favorable for pregnancy establishment, and they end up being substantially more fertile than the ones that fail to express estrus. Again, those cows that fail to express estrus, they do breed as well. That's one of the powers of fixed time AI. But when we compare them, they have, on average, lower pregnancy rates, both in a fixed time AI and an embryo transfer setting. And again, it's neat that we can go there and, assign, let's say, estrus or estrus detection aid patches, what we call scores. And this is a system where you go from 1 to 4. This is a nice study from Dr. Kai Poller. I forgot to put his reference here, but basically he collected blood samples on day 28 and quantified the circulating concentrations of PEGs. Okay, we know that the greater the circulation of PEGs, as the circulation of PEGs on day 30 increase in gestation, we see a gradual increase in the likelihood of that cow not experiencing pregnancy loss. Okay, so the lower the concentrations of PEGs on day 30, the more likely she is to experience pregnancy loss moving forward. And we know that, again, if she expressed more clear estrus with a greater estrus patch score, she has significantly greater circulating concentrations of PEGs 28 days later. Again, further highlighting that those cows that express estrus are more likely to successfully establish pregnancy. Hopefully I didn't go too much over time here, Vitor, but just to wrap things up, pregnancy losses are naturally occurring in the herd, and they do in fact have a significant economic impact, but there are things that we can do as producers to minimize those pregnancy losses. Most of those management strategies are associated with minimizing stress and optimizing nutritional program, whether we're talking about maintaining those cows in a good energy balance or in a good mineral program. But not only that, there's some newer opportunities for some precise supplementation strategies, or some we refer to as nutraceutical strategies, to actually optimize fertility, targeting the development of those conceptuses. Okay, and again, those females that do express estrus, they are more likely to not only become pregnant, but actually maintain that pregnancy. So we can use that information to our advantage as well when we're, let's say, assigning a specific semen straw to a cow, and depending on the value of that semen straw. And for those of you that are dealing with a lot of embryo recipients, you can use that information as well when we're assigning embryos to recipients as well, to try to favor those embryos that, we might prefer a specific mating. Out of the embryos that we're transferring, we can favor those cows, those recipient cows that actually express estrus. So with that, Vitor, I'll turn it over to you. I'm not sure if you want to open up for questions now or wait until Dr. Jones.
No, we're going to wait. Okay. Thank you very much, Pedro. We're going to wait for Lee to present, and then we'll do Q&A all together at the end.
Excellent. Thank you.
No, thank you. That was great.
Is that showing up good, Vitor?
Yes. Looks
all
good.
Right.
Lee.
Thank you, Dr. Mercadante. So investigating pregnancy loss. So thank you, Dr. Fontes. That was some great information about how to get cows pregnant and keep them pregnant. So now I'm going to go into mostly what we consider really late-term pregnancy loss, but some of this still applies. As you can see from the picture here, if you find this octopus out in your pasture, this is actually some placenta with some of the cotyledons located on on that, and the cotyledons are the, the embryonic or the fetal contribution to the placentomes. But if you find this laying out here in your pasture, like I did, then you're going to want to collect that and call a veterinarian and say, hey, I've got this pregnancy loss. What's my next step? Really and truly, when we do that, when I talk to a client about pregnancy loss, I'm going to go with a history. I'm going to ask them questions. If it's my client, then I really know the herd health program, because I'm intimately involved in the production program of my clients. So I know most of this, but I work at a diagnostic lab as well. And sometimes people call that I'm not very familiar with their program. So I'm going to go through and ask a lot of questions. They want to get straight to an answer, and I want to get to an answer too. But finding some history, some information, herd health, any biosecurity programs that they may or may not have, changes that have happened recently, those kind of things. I'm trying to get all this information to formulate a diagnostic plan. There are hundreds of tests that we can run, but typically we're going to run a handful of tests, target those tests to be as efficient as we can, not to spend money unnecessarily, but to spend what we need to spend to try to get an answer. Our rule out list is going to have several viruses on it. Bovine viral diarrhea virus and bovine herpes virus are two that we commonly see. Blue tongue down in the southeast is very common. We don't really know what level of contribution it will contribute to abortions in cattle, but we know that it can contribute to abortions in cattle. But from the viral standpoint, we're looking at BVD and IBR, or bovine herpes virus 1. From the infectious standpoint, and when I say infectious, I'm talking about any type of organism, virus, bacteria, fungus that will infect a cow. Infectious doesn't necessarily mean contagious, but it is, a case of trichomoniasis. That's a parasite that lives in the reproductive tract of bulls. Lepto is a bacteria from the environment that lives in the kidneys or reproductive tract or urinary tract of cattle. Vibriosis or Campylobacter fetus, this is the V in a VL5 of the vaccine. That lives in the reproductive tract of bulls, and it's a sexually transmitted disease. Neospora is a parasite that cattle get from the feed, contaminated feed. Anaplasmosis or Anaplasma marginale is a bloodborne parasite spread by ticks and infected needles. Less common things, Staphylococcus, brucellosis, though we don't have brucellosis abortus in many states. There are some states that still have brucellosis, and we do have Brucella suis in the wildlife, or in the, in the wild pigs. Ureaplasma shows up periodically. It is a bacteria that lives in the reproductive tract, and occasionally it can contribute to abortions. Listeria comes from infected or contaminated feed. It's Listeria species can cause a variety of problems, and abortion is one of them, and it typically comes from the feed. Non-infectious things, nutrition. That's what Dr. Fontes just covered. Great, has a great program. So we definitely want to make sure our nutrition program is covered. From a toxin standpoint, there are nitrates, there's moldy feed, there's mycotoxins. Those kind of things can actually get from the cow. When she eats these things, it gets into the blood of the cow, and then it goes to the placenta or the fetus. Most of the time we can diagnose agrothiosis or poor body condition. Sometimes the supplements are inadequate, vitamin A deficiency. So we've seen some of that. I'll show a little slide on that here shortly. And then there's some genetic causes we'll not go into. And then occasionally we've seen some traumatic causes where a real aggressive cow or something injures one, and the stress and the pain causes abortion. So when we're looking at investigating abortions, it can be really frustrating, and we need to have realistic expectations, because sometimes we're dealing with a hit and run situation where the bug that caused the abortion or the fetal death actually may or it may have come and gone. Hopefully we've got some evidence, and we're just trying to do an investigation with whatever tools we have to answer why. And one abortion may not be worth a lot of effort to pursue. Some level of abortion, while it's not desired, it's quite common. And we need to try to figure out, okay, is this something that maybe I should anticipate additional losses? Maybe I've got some suspicions of some feed, or some suspicions that maybe we have something going through the herd because I've got other clinical signs. We want to go ahead and take that one animal or that one abortion and maybe collect samples to save for later, or at least begin to collect some history. Abortion storms can be caused by contagious agents. If I've got a group of naive cattle and I introduce a PI, BVD PI, then I'm going to see an abortion storm. Or if I feed something in the feed, some contaminated feed or something toxic in the feed, then I'm going to see an abortion storm. So abortion storms don't necessarily mean I've got something contagious running through there. But again, I've got to collect feed samples and a lot of other things, and have my veterinarian involved with that. Some abortions caused by infectious agents are opportunistic and really don't affect multiple animals. And I'll talk about things that are endemic in the herd. So a thorough history and thorough samples are absolutely necessary. So this is called an epidemic curve. And so what I'm wanting to find out is this something that's like a quick insult, and then I'm seeing a storm? It has a typical bell-shaped curve where we see a rapid rise in abortions and then it kind of tailors off. Or is it something that's spread out over time? And these things, something that's in the environment is going to hit every once in a while. Something that, is kind of a point source, like the example that I used of a BVD PI introduced in some pregnant cows or pregnant heifers that causes a typical bell curve storm, or something that's endemic every once in a while, and there's really no dots to connect with an endemic problem. And so it's sometimes I'll get an abortion here, an abortion there. And as an owner, I might not realize there's any kind of relationship, but this is where it's important to have that conversation and keep really good records. So if something's sporadic, I may not chase this down very hard. If something's epidemic, it may be self-limiting, and I might be able to identify an obvious cause and get to an answer pretty quick. But if something's endemic in my herd, this might be worth more investment and to find an answer, because I probably can do something about that, or at least change some management. So, the first contact, doc, I've got an abortion. What do I do? What I want to know is, did you find and save the fetus and the placenta? And I want that fetus that's not been scavenged by, coyotes or buzzards or whatever. And then I want to, if I can, I'd like to take the entire fetus, unless it just stinks to high heaven. I'd like to take the entire fetus to the diagnostic lab. I really want the placenta. It improves the odds of a definitive diagnosis. Kansas, in their newsletter, just came out and said that if they get a placenta, that they have they're 4 times more likely in actually getting a definite diagnosis. And then I want to collect blood samples from the cow that lost the abortion, if she can be identified. And then I'd like to collect blood samples from other unaffected animals, and that'll give me some comparison. And then I definitely want to make sure that I get all of these samples if possible, because this is going to help me kind of triangulate the diagnosis and give me a better view of what's going on. So the fetus, submit again whole if possible. I don't want to freeze it. I'm going to talk about a sample set in the next slide. And if your veterinarian does a necropsy, collects the samples, if you can take a video, today with pictures and all of that, that's really going to help the pathologist when they're looking at it. We want to make sure that we're very systematic when we do the necropsy on a dead fetus. This fetus can be anything from, midterm to all the way to late term abortion. So I want to make sure that I get samples from as many things as possible. These are the things that I'd really like to turn in. So formalin fixed. If you don't have formalin, then hopefully your veterinary clinic does. And the veterinarian can collect samples or just take it all the way to the diagnostic lab if you're close enough to drive it in. These are fresh. We don't want them frozen, but we do want them refrigerated. So I'm going to take part of the placenta, both the cotyledon and the chorion. So the carbuncle part of the placenta is in the cow, so I won't get a sample of that. But the cotyledon and the chorion for both a fixed and fresh, because they're going to send it in fixed and look at it under a microscope. Skeletal muscle, I want to look at that. That's going to, if I see things like neospora or something like that, ear notches, that's good for BVD testing. The thymus, I'm going to take part of the thymus for fresh, part of it's fixed, lung, heart, liver, kidney, spleen. You can see I really want to take as many samples here and fix some of those or send them in. Brain, I want half in the fixed material. So, and then fluids, eyelids can be good for fungal testing. Fluid, stomach contents. So whatever's in the amnion is swallowed by the calf. And so I may not be able to test the amniotic fluid, but the stomach contents of the calf should be a sample of the amniotic fluid. And then thoracic fluids, those loose fluids that's in the chest of a calf, I want to suck those up into a syringe also and save those. Again, not frozen, but refrigerated temperature, and get those to a lab if I don't take the whole thing. The blood samples that I want to take, a lot of times people will just send a blood sample in on an aborted cow. And they say, well, tell me what caused the abortion. All I can do is serology. And what that does is that checks for the antibodies that are circulating within that cow. If I do collect a purple top or something where I can check PCR, this is an anticoagulant. This is really handy if I'm going to do PCR for something like Anaplasma marginale. And then I also want to go and check some samples 3 to 4 weeks later, because if I see a change in antibody levels, that's going to be very indicative of exposure. If my levels are the same, if I have good antibody levels from my vaccination, then I'm not going to be able to tell what was exposure and what was vaccination. But if I've got one sample that's really low on antibodies and I come back later, 4 weeks later, and I find another sample after the abortion occurred and the antibodies are really high, then that suggests that something like that might have been the cause of the abortion if I see a change. Again, unaffected cattle, affected cattle, just as a comparison, kind of give me that perspective. And it's not uncommon to see very variable titers to the leptoserovars that are in our vaccines. Diagnostic tests really depends on the samples and the kind of pathogens that I think is involved. Again, that's why history is important. Placenta, fetus, serology, all of that comes in. And you can see just some of the tests that we do. So we can be quite confusing about which test to ask for, but it might be PCR, immunohistochemistry, fluorescent antibody test, or histopath, cultures, viral isolation, ELISA, that type of thing. So what do I do with the results? If I find BVD, that's good news. I've got an answer, and my approach to that would be test colon clear. There's a myth out there that I can vaccinate my way out of BVD. It's just not the case. BVD can be very, very frustrating. Plus, our vaccines, we have vaccine type BVD type 1A and 2. Most of the wild type that I've found out in herds is 1B. So our vaccines aren't really targeting the most common wild type. IBR, what we see a lot of times is an IBR abortion is actually related to vaccines. And this is where modified live vaccine to a naive cow can actually cause abortion. So some of our IBRs that they've detected in abortions have actually been vaccine related, very few of the wild type. So if it is the wild type, we're going to address this with a aggressive vaccination program, alternate killed and modified live. If it's the vaccine related, then we're going to set our cows up a little bit different and change our vaccination program. Vibrio is only present in natural service, so we're going to test and treat or cull bulls. Amarginality and anaplasmosis, this is a test and control. It's really hard to eradicate in a herd and might not be worth doing, so we may just have to manage it with a veterinary feed directive and feeding CTC. And then the anaplasmosis is likely in the environment and the ticks. Trichomoniasis, this is typically an early abortion, but if we find a lot of late bred cows and we find trick in the herd, then we're going to test and cull the infected bulls. Lepto, vaccination program, try to reduce potential reservoirs because it is also in the environment. It can be a sexually transmitted disease from infected bulls, but cows can also pick it up from the environment. Listeria or fungus or mycotoxins, this is where we might test our feed and manage our feed a little bit better. Ureaplasma, this is mostly a health and hygiene. Some of the cases I'm familiar also involved reused seeders. So that's definitely something we want to be careful about because we can pass ureaplasma through reusing seeders. Neospora, it's a little bit like Listeria and the fungus. It comes in the contaminated feed. Should we test and cull? Some people have recommended that, but most of the time a cow's just going to abort after she's first infected, and after that she won't abort again. So serology can be frustrating and confusing because sometimes we're not able to differentiate between exposure and vaccination, but it can be very, very helpful. Unfortunately, the majority of abortion investigations, either at the lab at Georgia or Kansas State, don't result in a definitive diagnosis, a definite answer. But a lot of times the investigation will reveal some biosecurity challenges or things that I'll get to your, I'll try to get to your question here in just a second, but a lot of times these investigations will reveal something that we can change in management. Maybe we'll look at how cows are vaccinated. Maybe we look at a biosecurity program. Maybe we look, like Dr. Fontes was talking about, maybe we look at our nutrition program and find something there that we can make a modification on that. And so those kind of things, because we find too that, like I said, a lot of these agents that'll cause abortion are a little bit opportunistic. And if animals are a little thin or nutritionally challenged, then we actually can find some of those those pathogens are actually more potent at causing abortion in those cattle who are a little bit more at risk. This graph down here at the bottom was from the Kansas State Veterinary Diagnostic Lab newsletter that just came out first of this month. And it just shows some of the comparisons of the different things, both in 2022 and 2021, some of the things that caused abortion. So you can see leukosis virus, anaplasma made that list. Neospora, there was apparently a big, outbreak of Neospora in 2021. Nitrates are always a possibility in some of our hay. That's why it's so important to check that. In this case, Dam Nutrition was implicated in one lepto. Didn't say which bacteria. We did find some vitamin A and E deficiencies that contributed to contributed to abortions because vitamin A was hard to get at some of our mineral. And so that was the vitamin A deficiency. We sometimes will test the calf, the aborted fetus, and look at the liver. And ureaplasma again came up. BVD, IBR, again, that could be the vaccine strain. Fungus, vitamin A again. So anyway, those kind of things are, it's really important to collect as much information as possible, use records, and then get some advice on the right kind of testing. So with that, I am actually done. We can go back to maybe answer some questions. So somebody had a hand raised.
Yeah. No, I appreciate that, Lee. I just want to remind everybody, there's a Q&A tab on the bottom there, so you can type your question, and then we'll do our best to answer as many as we can, with both Dr. Fontes and Dr. Jones. So, Lee, there's one question here from Carol. Since we just talked about this, so how many diagnostic labs are in Georgia? And I guess a more general one for people that are not in Georgia, what's the best way for them to find out the address and the phone number for those labs?
Okay. Can you hear me okay? It says my internet is unstable.
No, we're good. We hear you.
Okay, fine. So our diagnostic lab in Tifton, that phone number is area code 229-86-3340. 229-386-3340. So if you'll call that number and you can ask for me, I should be there tomorrow. I can give, if you're up in the north part of the state, the Athens vet school, and I don't have that number handy, but you can also Google it. Look for the College of Veterinary Medicine diagnostic labs, and both the Athens and the Tifton labs come up.
Yeah, just an example. So here in Virginia, we have the Virginia Department, so called VDEX, right? So if you Google on your state veterinarian diagnostic lab, every state have a state agency that can do this. Another great resource, right, is their extension agents. They should have a contact to the extension veterinarian on the state, and they can also get you to the closest diagnostic lab on your region for sure. Lee, you also mentioned about nitrates, and there's a couple questions about nitrate levels on water and potential for pregnancy losses. Do you know, or can you comment on what those levels are that can cause abortion?
So it really depends on which kind of nitrate. So there's different nitrites, potassium nitrate. There are different levels. Lab will have a reference list of, okay, safe to anything, safe to non-pregnant animals, safe or, dangerous to pregnant animals. So if you use their list, then that lab, if you send it to a feed lab and they send you back the levels from that hay, and remember nitrates, if you've got nitrates in the water and nitrates in the hay, they both that's an additive effect. So I might have safe hay, but if I've got other sources of nitrates, then that might be enough to make their total intake dangerous. But yeah, every lab that does the test has a reference range for the type of test that they do and what their recommendations are, those levels that they find in that sample.
On that same topic, question from Kirk Gray. Do you think that the drought of 2022 created more nitrate-related pregnancy losses?
And Dr. Fontes can chime in that drought-stressed plants are going to increase their nitrate content. And any type of plants that are already prone to producing nitrates, if they're drought stressed, then yes. And we absolutely recommend testing any forage that is produced, in a time of drought. If there's any question whether or not that they could be, those plants could be stressed or not, or even if they're frosted or potentially seen any kind of herbicide. But yeah, that's absolutely potentially true. So that's why we harp on testing your forages, test your forages, test your forages.
Perfect. So Pedro, there's some questions about dry lotting heifers. I know you mentioned that that research from George Perry. So if we're going to breed heifers in a dry lot, how long do we keep them in that environment post-AI before we can go to grass?
Yeah, that's a good question, Victor. And keep in mind that you don't necessarily have to keep them in a dry lot, right? After the first breeding. Dr. Perry, I didn't bring it up because of time, but he did a follow-up study that he actually turned those heifers out to graze, and they actually supplement them. If I remember right, it was 5 pounds of DDG. I might be off there, but basically they turned those heifers that were developed in a dry lot, but they have a supplementation source, a supplementation strategy to guarantee that those heifers, are going to keep a positive plane of nutrition. I think that's one of the main things there. One of the things that he mentions usually is that it's surprising that, usually those heifers get pretty entertained with, just running around and enjoying the fact that they're out grazing. But once you put feed out, they'll come to the bunk. I think the take-home message is there are situations where it's just not economically feasible to keep those cows in the dry lot. But if you can figure out a system where you can keep those heifers in a positive plane of nutrition, that's key. So if you have an idea of what kind of grass do you have, and you can, do a target supplementation based on what you have and the requirements of your heifers, that's probably the best approach. It depends, right? It will depend on the operation. If you can keep those heifers around, that's good too. With regards to timing, if those heifers, the studies that he did was really a short restriction, right? So the first week after AI. And there's not a whole lot of other literature out there because basically he was trying to replicate what happens in the field, right? Let's see that Sandy raise her hand. She might have a comment.
Sure.
It's probably more common in her part of the world. Go ahead, Sandy. Do you have anything you want to add?
Yeah, one option rather than supplementing, and this was within some of George's work, was those heifers that were backgrounded on range and knew how to graze, all right, they may not need the supplementation. So supplementation is one approach. Teaching them how to graze early in life is another, assuming you have adequate forage when you turn out.
Pedro, there's a question kind of on the same idea with transportation though, right? Like moving cows and heifers post-AI. Can you comment on that again? What's the periods of when we see the most loss?
If you want to do it soon after AI as possible, that's ideal. Once that embryo reaches the uterus, it seems like it becomes more sensitive to that change in environment. So yeah, if you could, as soon as you AI, move those heifers rather than wait a couple of weeks, that's definitely favorable.
There's a specific question whether we know how much losses you do if you move them between day 4 and 14. Do you remember that?
How much
losses?
Yeah. 1 to 4 versus 14. It's gonna, we don't capture those losses. It's if you preg check them, you notice you're gonna have about a 10% decrease in pregnancy rate, if I remember right, somewhere around them. It's not like it's gonna be a train wreck. Nobody's gonna get pregnant, but you're gonna have suboptimal pregnancy rates.
Yeah. Pedro, there's some questions about heat stress. Yeah, sorry.
You're more likely to have suboptimal pregnancy rates. Let's put it that way. Yeah.
Sure. Some questions about heat stress and pregnancy loss. A couple of different questions, but can you comment on that? Do we know how pronounced that is? The effects that have on beef cattle and
there's not a whole lot of work on the beef side. There's a lot of work on the dairy side. Heat stress in general is detrimental. It's not controlled data, but the feedback that we get from the industry, mainly here in Georgia, when folks take too long to turn bulls in and herds that are breeding during the summer, sometimes they'll struggle towards the tail end of the breeding season. If they're spring breeding herds, towards the tail end of the breeding season, it gets pretty hot in here. Another thing one of the nice things that the dairy data shows is that a lot of those effects are in the oocyte. Not all of them, but a lot of them are in the oocyte. So one of the things that, you hear about dairy folks talking about is, if you transfer embryos, you overcome some of the, not completely, but you overcome some of the challenges of heat stress because you take that oocyte out of the equation. As far as I know, and feel free to jump in, anybody else that it's here, and share your opinion. But I don't see as much control work done on the beef side of things as there is in the dairy. But we do get that feedback from the industry. The way most of our folks here in Georgia overcome that is just by managing when they're turning bulls in and when they're managing the length of the breeding season and when the breeding season happens.
Oh, very good. I mean, yeah, I agree 100%. Philippe Moriel, he's not in the call anymore, but he's a member of the task force. And I know he recently got a USDA grant to explore heat stress on beef cattle. He's down in Florida, so we know the heat stress is real for sure. If you've ever been down there. So hopefully we get more data on the beef side over the next couple of years. So Pedro, there's a couple questions about deworming, and I know Lee, you can probably jump in here too about deworming. Is it advisable to deworm cows, their late pregnancy, or not?
I'll let you take that one, Lee.
Oh yeah, thanks. I know Valbazen has I think on the label, you're not supposed to deworm less than 45 days, but, typically we've used oral dewormers at preg check time. And if there was any, nowadays parasite management strategies are very different today, where we typically don't recommend routine deworming of cows in really good body condition. If they're in good body condition, they weaned a big calf, they probably don't need deworming. But anything that would be young and bred, then getting rid of the parasites, if they're parasitized, getting rid of the parasites is just going to improve their overall health. It's going to improve their body condition and hopefully improve the health of the future calf as she wastes less nutrition on fighting parasites and can spend more of that on her calf and maintaining body condition, increasing body condition, and then developing good colostrum. So there's no risks that I'm aware of for deworming cows. I think it's a really good practice. If you have thin cows at preg check time, heavy bred, it's really good practice to go ahead and deworm them. I'm a big fan of oral deworming, but it's a good practice to deworm cows, heavy bred, especially, if they need it, they need to get rid of the parasites. So absolutely.
Lee, on the same topic, there's a few questions about vaccination. Can you comment on when should we not vaccinate cows to avoid abortion, and what kinds of vaccines are safe or not safe for cattle that are pregnant, for cows that are pregnant?
So yeah, according to the label, as long as we've used the modified live, and I say the because, we can't change modified lives from a safety standpoint. As long as we've used the same modified live, then according to label, we're supposed to be able to use modified live even in heavy bred cows. I think a lot of us have gotten to the point that we're probably looking at killed vaccines if we're doing it at preg check time. A couple of reasons. The risk for causing abortions with IBR is, it's not there. Killed vaccines are safe. If we've already used modified lives, then the killed vaccine is going to stimulate more antibody production and enhance colostrum. So killed vaccines are safe anytime. Modified lives can be used at preg check again if that's part of the management program. We just probably want to avoid using modified lives during synchronization. If we're going to synchronize an AI or anything less than 30 days before turning that bull out, there have been some great work done by people on the task force that have shown that using modified lives has some risk of delaying breeding. And, the overall preg rates seem to be really good at the end, but it seems like some of those early bred cows or cows that get modified live may have a delayed fertility and get bred a little bit later. But again, that whole vaccination talk, really that needs to be between the owner and their veterinarian. I don't want to inject myself into that, because there's so many different variables that comes into vaccination choices and when to add it. But as long as you understand the advantages and disadvantages of each approach, and then make a decision that works best for your ranch.
Pedro, there's I think 2 or 3 questions that are on the same topic, which is different pregnancy loss between different bulls. Can you comment on that?
Yes, that's a great question, and I didn't bring that up because of time, but there's a lot of data now to suggest that we tend to think about the bull as and the sperm as a DNA bullet, right? It goes there and deposits DNA into the oocyte, and that's it. But we're learning that it goes way beyond that. The sire seems to play a role on embryo development and pregnancy establishment. But not only that, we see differences in sire in those late pregnancy loss, late embryonic mortality, early fetal loss, right? Those losses around day 30 and day, let's say 70 of gestation. It seems to be a lot of variation between sires. And that's really intriguing, because there are sires that they do really well in the first preg check, let's say day 30, 35, but they seem to repeatedly yield greater late embryonic mortality. So at the end, when we're comparing sires, that becomes a little bit tricky. So I think there's, we're still on the research aspect of those things, but there's still a lot that we need to learn about how does the sire influences fertility beyond simply fertilization, right? It seems like diet's playing a role on that, diet of the sire, and intrinsic fertility differences between the sire. But again, very new reports in the scientific literature. These are things that we're really just getting our feet wet on it. We know that they exist. That's a really good comment. They exist, those differences in pregnancy loss between sire, but we understand very little about it. We don't know how to determine beforehand which sires are more prompt. We don't know any sperm parameters that might be associated with that, but any potentially genetic markers, but there's people working on it. So hopefully in the next 5 to 10 years, we'll know a little bit more about it. But yeah, great question. Great question.
Yeah. So Pedro, there's a question about Bosindicus cattle. Most of the data that you show is on Bostaros cattle. Does Bosindicus cattle have a similar rates of embryonic loss and pregnancy loss?
Yeah, it's the Bostaros Bosindicus comparison, and you know that very well, Victor. It's a very hard comparison to do, right? Because it's not easy to find a place where we're privileged enough to have both animals exposed to the same environment. So there's some of that data that I showed in my presentation from Sydney Reese. She separated the data in Bosindicus and Bostaros. And there's some differences there, but we cannot dissect those differences out from differences in the environment. Because the data she has in Bosindicus, they're collected in different farms, different environments, a lot of it in South America, which was different, the environment that we have here. So we can't really dissect those differences out. But what we do know is that, they also experience pregnancy loss. And it seems to be very similar to what we see in our Bostaros population. Okay, there might be some small differences between subspecies, but again, it's hard. So one of the few data sets that we have. Hopefully in the near future we have more, Vitor, but we do know that there's some subspecies differences with regards to how they respond to nutrient restriction, right? What we see is that those Bos indicus influence breeds, they tend to be a little bit more tolerant to nutrient restriction when it comes to pregnancy establishment. So the way we know that is because we did transfers, within the same herd, within the same location. We had Bos indicus influence cows and Bos taurus cows as recipient cows receiving embryos. And we generated that control data with half of the cows being restricted, but half of the cows not being restricted. And we see that, within the same situation, within the same environment, if we offer the same restriction, okay, the Bos indicus influence cows tend to have less of a decrease in pregnancy establishment compared to the Bos taurus. In other words, they seem to be a little bit more resistant. We don't really know why, but one of the arguments could be like, well, they basically have lower nutrient requirements, right? So if you go there and expose them to the same nutrient restriction, they are better able to cope with the nutrient restriction. It goes back to some, good cattle sense, right? And knowing our cows and our environment and trying to do the best to match those animals to our environment. But I guess I went around a lot, but just long story short, we don't really know. Good question again. We're trying to understand, but that's, as far as I know, that's I shared everything that I know in the last 30 seconds.
Yeah. So Pedro, a lot of interest on the omega-6 data that you shared from Reinaldo Cook. So can you, a little bit, there's a question about, can you elaborate on the use of PUFA, so the polyunsaturated fatty acids, what kind of oil specifically, and again, what are the most important days of supplementation for it to be fed?
Absolutely. The studies and the products available and producers are using now, they are using, if you look in their literature, there's a lot of fish oil and algae and other products that they're more rich in omega-3 fatty acids. So most of the work that has been done in beef from a conceptus elongation standpoint has been done with omega-6, okay? Reinaldo, I think, has over 4,000 inseminations on cows and control studies showing those differences in fertility, okay? And the supplements that they use is calcium salts of soybean oil, where basically the reason why they use calcium salts is to partially inhibit the biohydrogenation process, right? So those fatty acids, they're unsaturated, right? They're polyunsaturated fatty acids. If we simply put those fat sources in the rumen, the bacteria of the rumen is going to break those down into saturated fatty acids. So they need to be in a calcium salt format or some other type of protection so that those fatty acids remain, to some extent, a lot of it is going to be broken down anyway, but part of it's going to go straight to the intestines so that the animal can absorb that fatty acid. And what's neat is it's not a matter of energy. Of course, energy is important, right? But it seems that the profile of those fatty acids are what's driving those differences in fertility, okay? So, it's not any source of fat that it's going to automatically lead to an increase in fertility. Well, if you have animals that are in a suboptimal energy balance, you might, but all that work, or at least the bulk of the work that has been done, they're using isocaloric diets. So in other words, is the biological effect of those specific fatty acids.
And in the supplementation, I think in most of those studies, and we participated, you and me, right? And it's the first 21 days. So the recommendation right now is that you start feeding your cows when you do the synchronization so that they get used to eating on the bunk. For example, if you're not feeding them on the bunk, which most people are not, depending on where you're breeding, but you get them used to eating, and then you start the supplementation of the calcium salts of soybean oil on the day of AI, and you do it until day 21. at least until the first 21 days post AI to really see that effect, right, Pedro?
Yes.
Guys, I'll be honest, there's a ton of questions, which is awesome, right? There's still 150 people here with us on a Tuesday night, which is amazing. Really appreciate. But, you know, we cannot stay here for too much longer and answer everybody's questions. So I want to wrap it up here. I want to thank Dr. Pedro Fontes, Dr. Lee Jones, for spending the Tuesday night with us talking about pregnancy loss. Remind everyone that this is going to be it's being recorded and will be posted on YouTube channel over the next 2-3 days after we do some editing. So it gives us a couple of days to do that. If your question was not answered, I want to also remind you that we have a Ask the Expert tab on our website, beefrepro.org. So you can send those questions there, and we'll do the best we can to answer those within 72 hours usually. So please don't get mad at us. A lot of good questions, but just for the sake of time, I'm gonna again thank everybody, thank our sponsors, and we'll see you next month on March 28th with the next webinar. So thank you very much, and let's keep breeding cows.
All right. Thank you, Dr. Mercadante. Enjoyed it very much.
Thank you, Vitor, and thank you, Dr. Jones, and everybody in the task force. We sure appreciate it.
Thank you, guys. Have a good week.
You too.